also be a symptom of a heart attack if it's in the right context. And within that, of course, we know that there are some groups of particular sort of minorities. For example, in the South Asian population, we know that only about a third or more of people understand that tightening or squeezing sensation in the chest might be a heart attack symptom, compared to about 50 to 60% of the general public. So I think there's a whole piece of work to be done to try and get this awareness out there in the communities, so that we can make a big impact by trying to save lives the earlier we get to people if they're having a symptom of heart attack.
Definitely, and anyway, it's such an important topic to educate viewers on, especially viewers from the Black, Asian and ethnic minority audience out there. And just in simple terms, what is a heart attack? Do we know what causes a heart attack? And maybe it might be nice to actually touch on a bit about the science behind the condition.
Yeah, so heart attacks are generally caused when the arteries, which are small tubes that supply the heart muscle with blood, which carries oxygen and nutrients, when those tubes get blocked. And that can normally happen because a blood clot can happen if there's furring up in those arteries because of years of smoking or other causes. Then a sudden blockage of that artery will lead to the muscle that it's supplying being starved of oxygen. And the longer it's starved of oxygen, the more likely it is to die. And then, of course, heart muscle doesn't regenerate. So once that muscle is dead, then you've lost that bit of the heart. Now, if you survive, then you may live and carry on, but we'll have a damaged heart. And that can sometimes cause symptoms of heart failure and breathlessness and other problems. However, if you're unfortunate enough that you don't get help in time, you can have what we call a cardiac arrest, and that can cause, unfortunately, death. So that's why it's really sort of critical that anyone who's having symptoms of a heart attack gets help early, so that the artery can be opened up as quickly as possible. And we have fantastic technology nowadays that can do that. It's just a matter of time.
Definitely. I think that's why they say, the faster you act, the better the treatment and the better consequences, for both parties, the family and the patient. And you mentioned symptoms. Most people, when they think about heart attack, they just think about chest pains. What are the other symptoms that you should be aware of, and that most healthcare professionals as well should also take note of when it comes to a patient going for a heart attack?
Absolutely. It's a really critical question I really want to try and get across today. So I think the key, as you said, chest pain, people do understand the word chest pain very well. However, chest pain means different things to different people. And it's important to understand that when we talk about chest pain or someone says chest pain, what they often mean is a discomfort around the chest. So typically, people will feel either direct pain, but they may also feel a sense of pressure across their chest, a heaviness. Sometimes there are diagrams of people showing that there's a belt around the chest, a really tight belt. Other people might describe it as like someone sitting on their chest. So I think the more appropriate word is probably a chest discomfort, however you sense it. But the key is that it feels uneasy, it's not right, there's something wrong, and you will sense that if you're experiencing that symptom. But beyond chest pain and this sort of sensation of discomfort and tightness, you can, of course, get pain that radiates. Radiates meaning it spreads. Typically, it can go up on your left arm, or it can go up into your neck or jaw. So that's another thing to be looking out for. Beyond that, sometimes people might feel dizzy or lightheaded at the same time. Sweating is another common symptom. Some people describe when they see family members having a heart attack, they look very sweaty, they look a bit cold, they don't look right. And then the other symptoms are maybe feeling breathless. Sometimes people vomit and feel sick. And generally, one of the common signs is also just this feeling of anxiety, of something that's really wrong, something right. So there's a whole host of these symptoms that can happen in a heart attack. Most of the time, as you correctly said, it will be a chest discomfort as the key sign, but there might be others, and it's important that everyone is aware of all of these symptoms. And then the final thing to say is that sometimes, although a heart attack can be happening, the pain or discomfort may not be severe. So it might just be a minor discomfort or something that you've noticed, you're just kind of trying to carry on with, you think it might be indigestion. But just be alert. If there's any of those other symptoms, then it might be something more sinister and you should seek help.
Definitely. And, it's really important that you mention anxiety there, because both mental health, what I've certainly noticed in a lot of my, medication reviews with patients, is that mental health has been a really big thing when it comes to cardiovascular patients. And just, before we end on our break here, are the symptoms the same for both men and women?
So has been some research in the past that suggested that maybe women might experience some other symptoms, a bit like maybe perhaps more breathlessness, some nausea or back or jaw pain. But generally our approach as cardiologists is that if someone has discomfort and they might be having a heart attack, don't look for things that might be specific to genders or sexes. Just go treat them as a heart attack. So if someone looks like they might be having a heart attack, whatever symptom combination they've got, get help.
Definitely. Thank you. Right. Thank you so much, Mr. Patel. You've been really informative and great during part 1 of our show. We will be joining Mr. Patel again for part 2. We'll be talking a bit more about treatments, causes, and also prevention of cardiovascular disease. Like we said before, cardiovascular disease, it's one of the leading causes of death within the UK. So it is a really important topic to be aware about, and also to know what are the signs to really look out for when it comes to heart attack. For more information about cardiac health in general, you can visit the British Heart Foundation website and also the NHS site alone. Join us again for part 2. Looking forward to chatting to you all again. Welcome back after the break. My name is Nyrah. I'm a GP pharmacist and I'm your host for today's health show. So in part 1, we actually introduce our lovely guest, Professor Patel. Now, he is a professor of cardiology at UCL. We were talking about cardiovascular health and what are the signs and symptoms to look out for if you are experiencing a heart attack, and what are the actual key benefits of actually reporting your symptoms early. It'd be great to actually reintroduce our guest again and ask him a few more questions. Hi, Professor. Thank you so much for joining us again. Before we just jump straight into part 2, I've got a long list of nice questions to ask you. It'd be nice to find a bit more information now about treatment, causes, and prevention of heart attacks. So one of the questions I had was about survival rates. Now, when you hear the term heart attack, a lot of people might think, it's so severe, no one's going to survive this. What are the actual myths surrounding, survival rates? What is the actual survival rate of a heart attack?
Yeah, so that's a really good question. And I think if you'd asked me that question about 30 years ago, or even longer, 40 years ago, it would have been a very different answer. And that's when heart attacks truly were very life-threatening, and it almost certainly meant either death or significant disability. However, today we have fantastic new technology, new treatments, and infrastructure that allows us to get people treated very quickly and very well. So that on around an average year, we have about 80,000 heart attack admissions across the country. And we estimate that about 7 out of 10 people will survive to leave hospital. However, we know that if we can get people to come to us a bit earlier, we might be able to increase that to around 9 out of 10. So the survival rate is really very good for what has historically been a very scary event. So I think that's probably the key message, as we reiterated previously, is that if there is a concern, your best chance of improving survival is to get to treatment or healthcare professionals as early as you can.
Definitely. And you mentioned, earlier in part 1, the faster we actually pick up the heart attack, the greater chance of survival as well. What are there any other benefits of picking up symptoms early, or is it as straightforward as that, as it actually increases the risk, of survival?
Yeah. So as we talked about earlier, the way a heart attack happens is that an artery gets blocked and the muscle that it's supplying gets starved of oxygen. Now, if you can open that artery up as quickly as you can, you save that heart muscle. If you can save that heart muscle, you have less long-standing damage to your heart muscle, which means that you reduce the risk of having more problems down the road if you survive. For example, heart failure or requiring particular specialist pacemakers and all these other types of treatments. So it really is kind of saving the heart muscle as much as you can. And we have a saying within cardiology that time is muscle, which means that the longer you delay, the more muscle you're losing. So that's probably the key thing. But related to that, of course, is the survival. And then if you leave a heart attack very late, and we've all heard stories perhaps of people who felt they were having indigestion, they waited, and then sadly it was too late. So that's what we're trying to really avoid here.
Great. So fast action, better result. Definitely understandable, and a very key important message, to make across. And in terms of actually family members now, heart attack, has a big impact on the patient, but it also has a very big emotional impact, and a lot of family members, surrounding the patient. Do you have any advice for any family members that are actually going through or will potentially go through such a traumatic event?
Yeah, so I guess if someone in your family has had a heart attack and hopefully they've survived and they're back home, then it is a life-changing event. But the thing to remember is that heart attacks nowadays are not the same, life-ending event it used to be. So people can carry on and have an entirely normal life again if they survive a heart attack, if they've got to the heart attack center early, have been treated, and they can get back to normal life. And there are loads of medicines that we would use that patients will have to take, and family members can support the patient or whoever the relative is by ensuring that they take those medicines regularly, but also they understand that there needs to be various lifestyle changes. Maybe the whole family can start to eat maybe a little bit better if they didn't have a great diet previously, exercising, all those sorts of things. So in many ways, actually a heart attack might have positive effects afterwards for families. And we often see that, and patients do tell us that as well.
Definitely. You mentioned medication. Now, when someone's had a heart attack, they're usually discharged on a lot of medication. I know some of my patients recently had a medication review, and they had a heart attack. They were discharged, with a whole big bag full of medication, which is really overwhelming for a lot of patients. What are the types of medications would you expect on someone's prescription after they've been discharged? We're really interested to actually go through some of the medication. I think it'd be really helpful for a lot of viewers at home as well.
Yeah, very, very happy to. So typically, if someone has a heart attack, their treatment will usually be with what we call a stent, which is a tiny tube that is put inside the arteries to open up a narrowed or blocked artery. Now, to keep that stent open, patients will often need to take what we call blood thinning tablets. So these are a combination of aspirin and typically another tablet that might be called ticagrelor or clopidogrel, various names, but essentially there'll be 2 blood thinning tablets. And they're there really to try and keep that stent open and also to reduce the risk of more clots happening in the arteries later on. So that will be 2 drugs that the patient will be on. Then there'll be a third drug that's called a statin. And statins are known to lower cholesterol, and that's how they work. But they've also been proven in many, many studies over the years that they reduce the risk of further heart disease and further heart attacks. So they really work to try and stabilize any furring up that's already built up in your arteries so that you hopefully avoid a second or further problem later on. And then beyond that, there'll be another drug that is typically there to control your blood pressure, but it also helps with helping the heart to recover. So these are drugs that might sound like ramipril or lisinopril, those sorts of drugs. And then the sort of final drug that we often use is a beta blocker drug called, again, these sound like bisoprolol or carvedilol, those sorts of ones, commonly bisoprolol. And these are beta blocker tablets, and they are really designed to try and keep the heart rhythm in a nice slow state so that there's less chance of irregularity later on. And also they help to improve survival after a heart attack in the initial years. So typically a patient who's had a heart attack will go home with at least 5 different tablets, if not more, because sometimes we add in tablets to protect the stomach, because aspirin, for example, can irritate the stomach, so there might be an extra tablet for that. And there might be 1 or 2 other ones, but those 5 are probably the fundamental ones that we use to improve, and they're given really because they improve the outcome, they improve the prognosis for patients so that they have a better chance in the following years.
That was a really detailed insight into the the discharge medications. Thank you for that. And it's actually really important that there is that follow-up medication review with all patients after they have been discharged. So if you are at home, you've experienced a heart attack previously, you've been discharged on all these sorts of medications, which are still pretty familiar or unfamiliar to you. You should really have a medication review every year. You can ask your local pharmacist for a medication review, or you could even ask the clinical pharmacist in your GP surgery, or again, your doctor. Now, in terms of prevention there are certain risk factors, cardiovascular disease. What sort of tips could you give to viewers out there to actually reduce the risk of any further heart attacks?
Oh, I think we could do an entire show on that if we needed to. But I guess the key message is, and this is based on our experience here in sort of central London and to be fair across the country, is stopping smoking. I think that's the first and foremost advice you can give. We can give all the tablets in the world, but if you're smoking, you're damaging your arteries every single breath that you take with a cigarette. So please, please, please do stop smoking, number one. Secondly, exercise. We do talk about this and we keep going on about it. But again, there are too many communities, too many issues where people don't exercise as much for various reasons, but we need to try and get people to do more. And we normally say at least 30 minutes of brisk walking at least 5 times a week would be kind of a minimum that you should be aiming for. And then the third, of course, is always eating well and trying to do your best to eat as healthily as you can. The 5 fruits and veg a day, focusing more on the vegetables, not necessarily all the sweet fruits. I did have a patient once who said they're eating 4 mangoes and a pear or something, and that's not what we want to be doing. But generally speaking, vegetables are really good, and I'd encourage that to be more used in our diets.
Definitely, it's important you mentioned that, because it's all about that healthy balance, really. Making sure you can have your fats at the end of the day, but make sure it's healthy fats, or you're having healthy carbohydrates, just your oats, oatmeal, etc. It's definitely really important when it comes to the overall cardiovascular risk. And in terms of online resources, now obviously there's Dr. Google out there, a lot of misinformation online now. What sort of resources could you refer patients to for further advice regarding heart attacks and cardiovascular risk?
Yeah, so I think on the internet there are some really good, reliable resources that we recommend. So I think the NHS website, first and foremost, is full of useful information, and you can get lots of information there. And then you have the heart charities. So British Heart Foundation is probably the next most trusted resource and has lots of useful information, not only for survivors of heart attack, but how to prevent heart attacks, how to eat well, and more information about how heart attacks happen and what you can do to avoid them. So I think I would recommend those 2 sites probably first and foremost. Yeah.
Brilliant. Thank you so much, Dr. Patel. You've been a brilliant guest. And thank you for giving your very insightful input into heart attacks and cardiovascular disease. Right, I think that's the end of our show now. Thank you so much for watching at home. And if you have enjoyed this show, or if you'd like to rewatch it, you can visit our YouTube channel or our Facebook page. We will be back after Ramadan now. So if you do want any more healthcare videos, feel free to actually follow me on TikTok. I'll still be posting a lot of healthcare videos on my actual channel. My TikTok is Nyrah.Saleem, or alternatively, I do have a health page, Health with Nyrah, and I will be posting regular tips on how to have a healthy Ramadan. Take care. Looking forward to seeing you again after Ramadan. Ramadan Mubarak.